Taja. Welcome, everyone. We'll give folks a couple of minutes to roll into the room here. We've got, if you can believe it, 191 people registered for this webinar. I don't think they're all going to show up because it's a beautiful day, at least here in Toronto. So we'll see how it goes. So welcome, everyone. And we do have, as part of this webinar, the chat open, but I'll start us off here. My name is Dorina Simyanov. I'm AgeWell's Policy and Knowledge Mobilization Manager. So we'll just give a couple more seconds, I think, for folks to roll into the room. So we've got 85 attendees. And I'll just start with our land acknowledgement. And so although we're meeting virtually, I want to acknowledge that we operate on the traditional territories of many Indigenous nations, which have cared for the land for thousands of years, including Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And I recognize that the current treaty holders, the Mississaugas of the Credit Union. This land remains home to many diverse nations, Inuit and Métis people, and is subject to the dish with one spoon wampum, which is an agreement to peaceably share and care for the Great Lakes region. I'm grateful to have the opportunity to work on this land today. You may live and work in different territories, so we encourage you to reflect on the land on which you are located and to consider your relationship to the land and to the people who are the traditional keepers of that land. So I'll give you just a moment to do that. All right, thank you. So today is a very interactive, catalytic conversation on social isolation and staying connected. Specifically, our topic is reducing isolation in older adults and staying resilient during the pandemic. And so what I want to tell you is just a bit of housekeeping. So we have some polls and some chat questions that we're going to be giving to you. And I want to encourage you to be active in the chat. If you want to tell us where you're joining us from. So as I just mentioned, I'm here in Toronto. I often refer to it as Raptor Nation, although we are not making the playoffs this year, unfortunately. And so great to see folks from across Canada joining today, and also from the United States, I see. So if you want to comment on any part of today's session, please feel free to type in the chat. If you've got a specific question you want to ask our panelists, use the Q&A function. You should be able to see that, and we will try and get to as many of those questions as we can. We are recording today's webinar. It will be available on our YouTube channel in the coming week or so. And with that, I'm going to ask each of our panelists to introduce themselves and also ask them, what does resilience mean to you? So in a time of where we are being asked to be socially distanced, to shelter in place, it's been a year and plus now of needing to really dig in and find ways to stay resilient, find ways to stay connected. And so I'm going to start with Chaitali Dasai, one of our caregivers on our Older Adult and Caregiver Advisory Committee, and just welcome you to the session and ask you to introduce yourself and say what resilience means to you.
Hi, everyone. Thanks for being here. My name is Chaitali Dasai, and I am a member of AgeWell's Older Adult and Caregiver Advisory Group. I live in the city of Markham within the general Toronto area in Ontario with my 4-year-old daughter and husband, who is a frontline healthcare worker. I do have many family and work responsibilities, which include supporting my father, who lives alone in the city. about 30 minutes away from where I am in Markham. I was also my mother's caregiver for over 5 years until she passed away in 2019 from dementia. So what does resilience mean to me? Well, my willingness to keep going when things get difficult, and to learn and grow and adapt so that I am able to get to where I want to go. But as I navigate through these difficult times, I have found just focusing on self-care, sleep, nutrition, exercise, and just creating time and space to just be has helped me get through it. Over the last few years, I have learned that prioritizing self-care really has strengthened my resilience and has helped me navigate these tough times a lot easier.
Thank you, Chaitali. I'm going to pass it on to Dr. Arlene Sell now, one of our researchers. Please introduce yourself and tell us what resilience means to you in this time.
Hi, thank you, Darina, and hi, everybody. So good to see so many people here. So my name is Dr. Arlene Sell, and I'm a psychologist working to promote positive aging. That's also my hashtag if you're interested. I came to Canada back in 2013 to establish a research program around using technology to enhance people's lives, especially those people who are living with dementia and their families. And I'm delighted to have been part of AgeWell since the beginning in 2015 and to currently lead the Staying Connected challenge area. So to me, when I was thinking about what resilience means, I think it's all the ways in which we get through and overcome challenges in our lives. And the past year in particular has really highlighted resilience across our communities as we've all worked together to face the challenges posed by COVID-19. So to me, our individual strength and the continued support that we have for one another is what resilience looks like to me.
Thank you, Arlene. And last but not least, we've got Charlene Natalie. I hope I'm pronouncing that right, Charlene. Please introduce yourself as well and let us know what resilience means to you.
Thank you. Yeah, you pronounced it perfectly. So I'm Charlene Natalie. I am the founder of Amintro, which happens to be an AgeWell affiliate partner. Amintro is a free social platform and information hub that was built exclusively for adults 50 plus as a means of reducing social isolation and increasing social connectedness. We focus on friendship, shared experiences, and knowledge at a local grassroots level. And resilience for me is our capacity as human beings to experience traumas and challenges and difficult times, but then dig deep into ourselves to pull out our values and our core values to get us through, to get us to finding ourselves again. And obviously COVID has absolutely tested us, but I think what's come out of it is focusing on family, focusing on friends, recognizing what really matters. And so to me, that's resilience.
That's great. Thank you, Charlene. So now we want to hear a little bit from our audience. We've got our first poll that we would like to do, and we just want to know which of these roles best describes you. I believe you'll see that poll coming up on your screen, and you can choose more than one role if you just simply cannot decide, and if you wear multiple hats, as many of the folks within our AgeWell network and beyond do. So great to see lots of community and non-for-profit representative or folks on the line, older adults, caregivers, researchers, trainees, some government folks, some industry folks. And if you identify as other, please type in the chat if you want to specify a little bit more about your role today. So really excited to see just a very diverse audience set here, and we'll give you just a couple more seconds to fill it out. I see about 80% of you have voted. perhaps we can close that poll now. So you can see the results there for everyone and for our panelists, so you have a sense of who's in the room virtually today. So we'll move on from that and move on to kind of our next part of our conversation today. So I'm going to pass it back to Dr. Arlene Sell, who's going to be telling us a little bit more about social isolation and setting the stage a little bit about today's conversation by sharing some slides with us and some statistics on the topic. So Arlene, when you're ready, feel free to go ahead.
Okay, here we go. So this should be my slides. Can you see those?
Yes, I can.
Okay. Sorry, you can see the wheel of doom. There we go. Hi everybody. So I'm just going to present a little bit of a summary, an intro to Age Well, just to tell you, just give you a bit of insights, and then a little bit of information about the challenges of social isolation. So as you can see, Age Well is an NC, and it's Canada's Technology and Aging Network. Why is the next slide not working? Oh, there we go. So the vision of Age Well is to take forward, to be Canada's leader in technology and aging, and to bring this actually to the world. So it's very big ambition, but I think Age Well has made a lot of strides in the last few years. And this has been achieved through the community of researchers and together with older adults, caregivers, other partners from industry, and really to create future leaders. There's a lot of focus on trainees and people coming in to this field to really get excited about bringing technology to make meaningful differences in the lives of Canadians as they age. Here are some of the numbers. So essentially you can see that one of the biggest achievements is the number of trainees, which are in Age Well are called HQPs. So these are the students, the doctoral students, the postdoctoral researchers, and you know there's many who are coming through and have already gone through and gone off to set up new companies, new initiatives, new products. There's also more than 250 researchers who are part of Age Well. And as you can see here, some of the figures are very impressive, the number of startups. There's 4 national innovation hubs, which are a really key output, over 200 jobs created, alongside these policy submissions, which are very important for keeping the needs of the aging population at the front of government thinking. There's lots of international collaborations, but also the numbers on this side, not only the numbers of universities and institutions and projects, but the numbers of older adults and caregivers who are engaged with Age Well. You look at some of the things that we've been doing, there's lots of partnership on solutions. So for instance, some examples around working with the smart home sensors and also the socially assisted robots. But you can see that really there's just a lot of activity going on with partners in industry, not-for-profits, government, and not just technologies, but policies and practices and services that can be adopted. Back in 2018-19, there was a big survey done and lots of work with meeting with communities across the whole country, which came up with the 8 challenge areas that you see here. So the one we're focused on today is staying connected, which is the one that I have the great pleasure of being part of and leading. But you can see the other areas that were identified as the priorities for Age Well by the community and researchers and industry across Canada. So let's just think a bit more about social isolation and loneliness. And some information from the Canadian census shows us how, first of all, how many people over 65 are living on their own. In the last census, it was approximately a quarter of older people. And we see this as a growing problem globally. So this is not just a Canadian issue, but more and more people are living alone, and this increases their risks of being lonely. We also know that COVID has really affected people's abilities to connect because of the need to socially isolate. And there was a survey conducted in Ontario last summer of nearly 5,000 older people, and just really asked them about their experience in the last week. And 43% felt lonely some of the time in the previous week. And this included just over 8% who always felt lonely or often. And interestingly, but maybe not surprisingly, there were increased risks, not just for people living alone, but also for women who particularly felt cut off by the restrictions of the pandemic. And we know that it's important to be, why this is such a big issue is because loneliness has many negative impacts. It's been linked to multiple different distressing things for people. So depression, stress, decline in people's functional ability. There's also a lot of health risks, which are comparable to the dangers of smoking and obesity. So this is a really serious issue. And it's also been linked to increased mortality and dementia. And I'm sure many people have heard this in recent years, that it's actually it's what's called a modifiable risk factor, which means if we can reduce people's social isolation and loneliness, we can potentially reduce their risk of dementia and other cognitive impairment. So just thinking then about ways we can tackle loneliness. So there's a couple of studies that have shown that increasing socialization can actually positively impact cognitive function. So a Finnish study showed that it had improvements even a year later. And a study of Chinese older adults looked at both socialization and Tai Chi as another intervention, which is normally done as a group as well. And they both had a big impact on cognitive performance. And also this was established in brain imaging. And I think that was very interesting because compared to walking and just not doing anything, and this was a really substantial impact. So it does show we can do things to reverse the cognitive decline. And I also just wanted to bring this back to keep us in the age well domain of where technology has been used. And also from 2020, a review that looked at all the technology interventions addressing loneliness and social isolation for older adults. And perhaps unsurprisingly, because this goes back 20, 30 years, they found that the majority of interventions were really things like how to use the internet, how to use computers, and to access communication technologies. Most popular and most common as well were simple, easy to use, off-the-shelf technologies. So not things specifically developed for an aging population, but really intuitive, easy to use devices like smartphones, like touchscreens, tablets, and so on. And the primary use was connecting with family and friends. So I think that really brings us to where we are now. And it's a great segue to handing over to Charlene. And I think she has a video to show us now. So I'll stop sharing. Thank you.
Thank you, Arlene. And so I will actually share that video for us. Charlene, do you want to say anything before I play the video, or should I just go for it?
Go for it. Go for it.
Awesome. All right. Give me a second here.
As we progress in life and the opportunity to continually make new friends and engage with other people, it starts to dwindle. When we lost my dad, there wasn't necessarily a large support group of friends for my mom. And we have no family nearby. I did a lot of research, originally focused on how can I help my mom, and by default then, help my brother and help me, and discovered this massive epidemic of social isolation and and loneliness. Amintro is a free online social platform and information hub exclusively for adults 50 plus. Our number one goal is to enhance the lives and the quality of lives of as many people as possible. Social isolation is a daily reality for many older adults, and with COVID-19, it has just multiplied the impact. We want to reduce the number of strangers there are in the world. We are not a dating tool or service or resource. We are focused on good old-fashioned camaraderie and friendship. You can use a computer, a laptop, a desktop, a tablet, a smart device of any kind, and you can sign up by a number of ways. You're asked a series of about a dozen questions, and we focus on not just hobbies, but where do you come from and what languages do you speak? And the algorithm then identifies other members. You can begin chatting within the platform with the end goal of actually getting out of the house, logging off, and actually meeting in person. AgeWell's impact on Amintro has been the greatest thing that's probably ever happened to us. It has absolutely exposed Amintro to a larger audience and built the recognition and the credibility for our organization. Our tagline is make friends, live life. And I really believe that people want to be in charge of their destiny. Life is a lot better when you have people to experience it with.
Great. So thank you for watching that video with us. And just going to close my screen here with the YouTube likes to start other videos immediately. So that's an amazing example of a technology that can keep us connected, not just in regular pre-pandemic times, but also during the pandemic. So we're going to move into kind of the second part of our talk today, which is what are some practical ways in which we can enhance our social connections? And I'm going to start with Charlene this time, since we just saw your video. Really interested in hearing what that's looking like for you and for Amintro users specifically. How have things gone during the pandemic, and how are folks staying connected?
Well, I mean, it's just exploded. You know, we existed well before COVID-19. No one could have foreseen, you know, this coming. We brought Amintro to North America in 2018. And, you know, we've got members in Canada and the United States growing daily. And then from March of last year to now, you know, the traffic has increased by about 800% each month, with people seeking, you know, a way to stay connected and to basically make friends at a local level. As the video said, the idea with Amintro was always, even though we're using technology, it was always for people to eventually, once they're comfortable, to log off and meet in person for a coffee or whatever the case may be. But because we also have features and functionalities within the platform to communicate and chat with other members that we call Amintronians, it's a safe environment during these pandemic times for people to comfortably build their social circles from the comfort and safety of their home. So definitely it has grown exponentially. We also are an information resource. We saw early on that the adult children were looking for access to information to support their parents in aging well. And so we have a great deal of video and editorial content that we make available on our public website, which obviously, again, has just grown immensely. Did that answer your question?
Yes, that was perfect. I want to remind our participants, so I see a couple of questions coming in about Amintro and just more generally about AgeWell, and so keep those questions coming, and I encourage you to use the Q&A function over the chat. If you just have a comment or want to share a resource on staying socially connected that you're familiar with, feel free to put that in the chat. I want to ask the same question to Chaitali. So what are some practical ways in which you've seen from your personal experience have helped with social connection during the pandemic and in your role as a caregiver?
Yeah, so I'll speak to my father's experience, which I'll talk a little bit about the impact of the pandemic on him. Even his reluctance to trust technology and some of the reasons why. But at the same time, he has motivating factors around using certain technologies as well. So my father is a retired 70-year-old with high blood pressure, diabetes, and sleep apnea. He lost his wife, my mother, to dementia in 2019. When his wife became ill, his routine was altered dramatically, and it took him years to reestablish a new one. But in the COVID situation, it's no different for him. Although he has reestablished a new routine since my mother passed, he found it initially very challenging to do so during the COVID situation. And like most of us, like he is most comfortable when he has a well-defined routine. And some of the reasons why he's so reluctant to trust technology during the pandemic is just simple things like obtaining his prescribed medications, some of which are high risk, such as insulin, is proving to be very challenging and difficult than usual during the pandemic. He has tried the home delivery service, but stopped using it due to repeated mistakes in his medications and delays in just delivery itself. And because of this, he prefers to get the medication in person from the pharmacy. And it gives him an opportunity to ask questions to the pharmacy as well, and the pharmacist as well, for the same reasons why he doesn't trust the online delivery option for his medication. He has refused to use online delivery options for groceries. So a family friend sometimes delivers his groceries for him, or at times he just steps out himself and puts himself at risk to get the groceries himself. But the distancing restrictions have also had an impact on his health. Since the pandemic started, the gym in his busy condo has closed down, and because of these physical distancing restrictions, he no longer goes for walks with his neighborhood friends. And I do my best to support my father, but I am finding it also very difficult to do that, as I am constrained by my own commitments to my own childcare duties and work, and distancing measures in place. So, and I lack an adequate support structure to help, and this structure has also been weakened by my husband, who is increasingly busy on the front lines looking after COVID patients. But there are practical ways that my father does stay connected through using technology. Fortunately, my father uses a smartphone, easy to use, simple tech, regularly to keep in touch. Usually, my sister and I both speak to him multiple times a day, by phone or text messaging. And recently, we've taught him how to use FaceTime. I've found that his personal motivational factors to use these types of technologies are really just connecting and maintaining that connection with family and friends around the globe. And even just learning new information. He has a curious mind. So just hearing, for example, hearing about the news around the world as well. So those are some of the motivating factors that you know, the reasons why he uses a technology itself.
Yeah, thank you for that, Chaitali. I think you did a really great job at highlighting kind of the challenges with some of the technology, right? There's, you know, at AgeWell, we always talk about how technology is one of the tools in the toolbox. It's not meant to replace the human touch and that interaction that we need, right? This is what Arlene was mentioning as well in her opening remarks. That we need that interaction. It's better for our health, you know, cognitively, physically, and our mental health as well. So I really liked what you said about his willingness to learn, right? I think like all of us, we've likely picked up a couple of additional technology skills during this pandemic. I feel like I'm learning new Zoom tricks every day. So with that, I want to pass it on to Arlene and maybe talk a little bit about you know, perhaps other examples of technologies or just other practical ways we can enhance social connections. I saw in the chat someone talking about an old the idea of a telephone tree, and you know, it's a classic, right? You call someone and then that person calls the next person, and it's a lovely easy way to stay in touch.
Yeah, absolutely, Darina. And I know that there is an initiative that students at the University of Toronto have been doing remote visits with long-term care homes because they couldn't do them in person this year. So you're absolutely right. And that's been done on the telephone much of the time. So telephones are still good. I was going to mention a few of the 8 specific AgeWell initiatives, and somebody's already mentioned Familynet. So I'll put the link into the Zoom, the chat, and then people can look it up as well. But basically, Familynet is another easy to learn platform, and it features pictures of the user's contacts. So it's easy for them, people who are not familiar with the technology. Is made for use on an iPad. And it has very simple icons as well to access messaging. It's particularly useful for helping to re-engage people who have challenges like vision, hearing, motor skill difficulties, and other barriers that might isolate them from other people or services. And as I say, it requires very little training, and I think that's a real key for a lot of technology. It has to be very intuitive and easy to pick up, and not require preferably constant support, else it's not particularly helpful, because then that puts demands on someone else as well. Another thing I wanted to tell you about, which is a bit different, but you might be interested to go and look at this one too. And this is someone who's is a researcher at McMaster and Brock universities, who's a linguist, and he is looking at the language people use and has developed an app. It's based around storytelling, picking up language that indicates people are lonely or isolated. And the intention there is to really try and help identify people who maybe are saying, no, I'm fine, but really their language could actually be indicating that they really are seeking or in need of human interaction. So I've just added a link to that. You might be interested to check out his app. And then a third initiative, which is also combines physical activity, is something new that's being created called To Race With Me. And some of you may have already seen examples of doing cycling on a fixed bicycle, where you can have a different environment passing by. I actually have a friend in the Netherlands who tried this out a few years ago, and she managed to get some of these bikes, and they would have these groups in like long-term care where people could cycle together. And that's a similar idea with To Race With Me. The idea is it can actually be something you can do either in the same place, but it's not using these same which are quite expensive, these the existing bikes. It's using hand and foot pedals for people to navigate the different environments. So it's a fun and a physical activity, and it's social. So all of those are really good things that are out there, and I will put a link to the web page where you can see that one as well.
Great.
So those were the ones I wanted to mention.
Thank you, Arlene. That's perfect. So lots of examples, high tech, low tech, around how to stay connected during this time and beyond. So we're going to move into kind of the last piece here, and Arlene, I'll be coming right back to you. So this is around how has the pandemic changed technology adoption among older adults, and I can tell you from we've been running a roadshow series over this past month, and we've been asking the question, you know, and this is for anyone of any age, you know, how has the pandemic increased your willingness or openness to learn new technology? And generally, when we ask that question, people, when we put that as a statement, people are either agree or strongly agree that they are more open during this time in picking up a new technology. So I wanted to take it back to you and have you talk a little bit about what the research is saying in this space. AgeWell has done a bunch of this research. If you could comment on that, please.
Yeah, absolutely. And I would say in some ways I'm absolutely delighted, because it's making my job a lot easier, because a huge part of what we've been doing for the last, I don't know, 8 years is trying to demonstrate, first of all, that people are interested in technology and they want to use it and they can use it, but it has to be introduced in the right way. And all of those things I was saying about being intuitive. And I think the pandemic has really pushed this forward a lot. So as you say, there was AgeWell conducted a survey last summer, which was sort of really in the heart of the pandemic, I guess. And it showed, first of all, that smartphone ownership had increased up to 65% of people over 65. And people were pretty much the majority, nearly 90% were using it daily. So I think that's really important. Then we find that video calling had also increased hugely. And I think that's really interesting, with about a quarter of people using video calling on their phones, which had doubled from 2019. And majority of those said it was due to COVID. I mean, we know that apps like WhatsApp, for instance, have always been popular because you can do multiple things with one application. But it's really interesting to see how this has promoted the use of video calls, and also, you know, using other platforms. So a third were using social media, and, you know, more present on YouTube, Instagram, Facebook, etc. And also increases in things like online shopping. We were just hearing about people using repeat prescriptions of medication and so on, although, as Chaitali said, there might be some challenges with that. And basically, nearly 3/4 of older Canadians said they feel confident using the existing technology. So I think these are really, in a way, positive findings. It might have been driven in part by necessity, but I think we have to make sure we leverage this and we make sure we move forward now and we don't slip back, and that things that were put in place to encourage and support this are not just maintained, but they're increased. So we keep reaching the people who are still not included in these figures and widen the accessibility. So I think this is positive and we have to build on it. So that's my thoughts about it.
Thank you, Arlene. That's great. So I want to take that thought forward, and Charlene, in your work with Amintro, how are you seeing this kind of play out? I think you started talking a little bit about just the increase that you've seen of the use of Amintro, but how do we sustain that now that there is this momentum around using technology during this time? How do we keep that interest and that willingness to be open to using new technologies and apps and perhaps devices moving forward from your perspective?
I think that what we're seeing is necessity really forced or inspired or motivated people that were perhaps a little apprehensive about adopting technology, forced them to push past that discomfort and fear. The fear of being disconnected was far greater than the fear of using technology. So I think we're seeing that. The empathy I mentioned earlier. I mean, everybody has been impacted by the pandemic. The irony with COVID-19 is it's not ageist whatsoever, right? And so with that empathy, we're seeing more individuals realizing the pain associated with social isolation. It feels horrible. It's devastating. And we're seeing new innovations. We're seeing it's finally put social isolation on the map. And so you're seeing, grassroots organizations popping up across the country with virtual activities locally, and very user friendly. When you're creating a solution for an older demographic, particularly a technological solution, you do need to design it for them. You do need to take into consideration physiological changes. There is color scheme that is important. There is how you lay out the platform and the technology, bearing all that in mind. I think we're going to see a lot more resources, local and greater, coming out of this because of the empathy that came out. And with all of the new and the opportunities, I think that is going to contribute to the ongoing adoption. And quite frankly, once you do something, it's like you're getting up, you're riding a horse. Now even if you don't ride a horse for 6 years and you get back on it, you remember how to do it. I think it's the initial introduction to technology that is, causes apprehension. But once you try it, you realize you're not going to break it. And I say this to my mom. I mean, I am not just the founder of Amintro. I was first the daughter of a really amazing woman. And I'm like, Mom, you're not going to break it. Get in there with like the WhatsApp, hit the buttons, like it's going to be okay, right? And once she got past that fear, like off she went. So I really think that is what will continue the expansion of the adoption by older adults of using technology. It won't be new to them anymore, and that's key.
Yeah, that's wonderfully said, and great, perfectly segues into our last piece of this, which is Chaitali. I want to hear your experience in all of this. So you talked a little bit about lack of trust there when it comes to certain technologies, especially when it's an important thing like medication. People are echoing that in the chat, right? You should be able to talk to your pharmacist, right? Even if you're getting that medication perhaps delivered to your home or something like that, there should be an opportunity for that exchange, even if it's not in person. And so again, we have a sense of how things have changed during the pandemic, but what has your experience been, and how do we move forward?
Yeah. So again, I'll speak to my father's experience, and I find this pretty interesting actually about him. He presents an interesting sort of contrast when it comes to his understanding and use of tech. On the one hand, during his entire career, 30 plus years in the government, he learned and applied advanced computer programming as part of his work. But today has reluctantly used communication media such as FaceTime and Zoom. And one of the biggest reasons why is that he did not initially find it user friendly. So he now uses FaceTime after a few nudges, but not Zoom yet. He continues to use his computer expertly, and as I mentioned earlier, he uses his smartphone regularly to communicate through text and WhatsApp messaging and things like that. But with unfamiliar tech such as Zoom, and even his medical devices such as his new CPAP machine, he just prefers hands-on teaching from either me, my sister or his healthcare providers to use it effectively. And usually with several refreshers. I have to say the CPAP machines are difficult to sort of put together, but so this process is usually repeated with each updated device, such as a smartphone. But I do believe that for him, the right tech could help facilitate his needs at home. But he requires technology-based solutions to be designed for him because of his lack of familiarity with modern tech-based solutions. So I hope I answered the question.
Yes, you did. Thank you. And it's interesting you've all kind of really brought up the training piece, right? I think all of you said that, right? Some sort of training, easy to use interface, and ensuring that whatever is being designed is being co-created with older adults in the room and helping with the interface and what, ensuring that the technology-based solution will meet their need. So that's really great. So I'm going to move into a question and answer period right now. I've seen a lot of questions come in the chat box and in the Q&A function. So a reminder to use the Q&A function so that we can keep things a little bit organized. And also, we have a question for you kind of as we close our session today in the last 15 minutes, which is, what does staying connected look like in 2030? So think about that as we answer some of your questions. So we've got quite a few questions for Charlene. I know you've been answering some of them in the chat, so that's great. There's a couple of different questions about how is Amintro different from some other applications. So we heard about Familynet. There's other ones like Meetup. So what makes Amintro unique?
Because we focus on friendship and we focus on connecting people that don't know one another. So we are our community is made up of individuals that are saying flat out, I have room in my life for more friends, and I am open to meeting new people for the purposes of friendship. Meetup is fantastic. I love what they do, but they connect people based on a common interest. The interest is never friendship. It's photography or a subject matter of some sort. And in our lifetime, our friendships were a byproduct of something else. It was never the focus. We go to school, we made friends there. We started our careers, we made friends there. We became hockey parents and whatever, and on and on and on. But then you reach a certain point where you're no longer going to work. You are no longer the hockey parent. You're not in school anymore. The opportunity to actually organically meet people for friendships doesn't exist, but Amintro does. So Amintro is the new playground. And Familynet, my understanding is it's connecting you with your family. So it's pre-existing relationships. Whereas Amintro is, we're going to create new ones. I think it's ironic and it's sad that we live in a world where social isolation is a growing epidemic globally. When you have that much volume of people that are experiencing periodic loneliness or just boredom, maybe it's just on the weekends or consistently, it doesn't make sense, because when you have that volume, there shouldn't be loneliness because there's too many of us out there. But the problem is there's nowhere up until Amintro, and I will put that plug in there, where we can connect and say, you know what, you seem pretty cool. We share some similar background. And there's also a lot we don't have in common that is quite interesting and intriguing. And I'd love to learn more from you. Let's chat. So that is the difference. We are built on the foundation of friendship. We are unapologetically not a dating site. We are all about friendship. And that's something that I think we sort of take for granted in our lifetime, but is so important to our health and well-being. So I hope that answers the question.
Of course, yes, that was great. Thank you. And so there's a couple of questions. I'm going to shift a little bit now And I'll start with Arlene. There's a couple of questions in the chat, and I might go to all of you with this one, because they've been for Arlene and Charlene, but I also want to hear what Chaitali has to say on this. And it's around safety and privacy, specifically when it comes to technology. You know, this is a big question and really important. So Arlene, you know, when we're talking about keeping up the momentum of increased technology use and increased use of social media, which we saw during the pandemic among older adults as well, what are we doing to educate older adults around the safety concerns or potential online abuse and misinformation that's out there?
Yeah, well, it's a great question, and I guess it's sort of like, if you think about it in the sense of, well, if we look at other sectors of the population like kids or, you know, the rest, you know, everybody else, who is responsible for that? You know, are we supposed to do it ourselves, or is it there's some statutory sort of thing? So I think there's been a lack of clarity about who could or should do this. I mean, certainly, if I speak to the examples of the work that we do a lot of we were before COVID, and we will resume again. We run interactive technology workshops, and one of the things we do is we bring lots of different devices in the packaging. We take them out, we look at them, and it really is an icebreaker to get people talking about sort of everything from selecting devices, setting them up, paying for them, getting support, but also the concerns that they have around what happens to their, you know, their data, how, you know, what are the security features and so on. Sometimes we do peer-to-peer workshops where people who are very savvy will talk about why they chose devices and what, you know, how they manage privacy and this sort of thing. So I think it is a growing issue that's being recognized. I'm not aware that there's been a concerted effort, but I think it can be tackled. And I think in any projects or products or services where we're, you know, bringing tech to people, we're trying to promote adoption, that has to be a clear part of it. And not just informing people, but here, you know, providing opportunities for people to express their concerns, because there is a lot of concern about what happens to my data when it goes off into the cloud. Like my dad used to say, well, what's it doing in the cloud? Right. He was joking, but it's also,
I still say that.
issue, right? Right. But
Yeah.
I mean, what is it doing in the cloud? So, yeah, so I think it's a great point. And I think, again, it's something AgeWell certainly would be, I would expect we'll be taking some initiatives on this.
Yeah, digital literacy, right, and the privacy components to that are really important. So I'm aware of the time, so we have about 5 minutes, and I know some people are dropping off, maybe getting ready for their next meeting. So again, a reminder to answer that, what does staying connected look like in 2030 in the chat. Lots of questions. It's unlikely that we're going to get to them all, and lots of interesting resources being shared in the chat as well. So please know that we will send out a follow-up one-pager to share all the links that we've shared with you and that participants have shared with some of these resources. If you are wanting to give us feedback on today's webinar and how it went, we also have a survey link for that. So we'll be sending that out, and you'll also find it in the chat. I want to give Charlene the opportunity to just quickly answer the safety privacy question, and then we'll do some closing remarks as well. And maybe you can answer the question and give us some closing remarks, Charlene.
Wow, no pressure. So that was one of the key pieces when developing our software and technology, was the security. So there are many reasons why Amintro looks and functions the way it functions. There was a method to the madness, and it had to do with security. So one of the features right out of the gate is when somebody joins Amintro, they have to provide their email address. Before they can actually join, they actually have to respond to that email. Okay, that's the first step. The second is when we make friend suggestions, or a member does a search and requests an introduction to another member. Both parties will receive the introductory suggestion or the request. Both parties have to accept it. If only one accepts it, they cannot, they don't become friends, they can't connect. Right? So it's a double approval process. The third is we have an abuse button. So if a member is behaving and it's big and it's bold and it's in your face and you can't miss it. So if anyone's behaving inappropriately, we will be notified and address it accordingly. Touch wood, we've never had any issues, you know. And I think that's because we're very clear about what Amintro is all about. So, you know, we also didn't use sort of geolocation technology where, you know, the system connects and knows exactly where you are. That's for safety and privacy reasons. We do it a different way that's very sort of manual, and that was intentional, again, for security and privacy. And of course, education, information, education. You know, the reality is if you're informed, you're going to make better decisions. I believe that fear of the internet has fed older adults feeling like they are vulnerable to being victims of scams. Ignorance does that. When you've got information and you've got knowledge and you're reading up, you are now empowered to recognize if there's a scam. I would give advice to my friends that are meeting people for the first time. Like, there are protocol that you put in place, regardless of whether it's an online introduction or it's an in-person introduction at a Mick Cafe, for example, right? You don't give out personal information. You foster the relationships, you know, eye contact, you get to know the people better. And so we provide a lot of tips and recommendations on safety, and we've just added safety in COVID.
Yeah,
you know,
that's great. I want us to, it sounds like you're doing absolutely everything and anything to make sure that it's safe and secure, and that's wonderful. I want to just 30 seconds with you on what is your hope for the future of social connection?
I hope it becomes a priority, and I hope that it becomes a hybrid of, you know, online and offline, and is that everybody realizes that they're all entitled to that, regardless of age, regardless of where they live. That should be a right of life, period.
Yeah, that's great. And Arlene, same to you, 30 seconds or so on what your hope is for social connection in the future.
Well, I've been reading some of the chats and some people's concerns about us becoming more remote and think, you know, the technology replacing the human interaction. I actually think we're seeing now, especially as the lockdown is prolonged, the intense desire for having those face-to-face in-person meetings again. And I really think we will go to a hybrid of, we'll be reaching out to people far away from us using video technologies and other media, but also we will still be meeting in person. And we've maybe meeting people that we've met remotely in person. And I think also an increase in activities where we can get together and socialize, whether they're physical, leisure, pleasure, artistic, creative, whatever. I really think this has highlighted how much we need other people, because it's a fundamental part of being a human. So I see us getting there through technology and just good old-fashioned getting together.
Yeah, perfect. And Chaitali, I'll give you the last word. What is your hope for the future in this space for caregivers and older adults like your dad?
Yeah, so I believe the hybrid model will work well in the future, I hope. And I echo everyone on the panel as well around that. And I believe that acceptance of tech-based solutions may be greater where technological help is not perceived to be replacing in-person care. So that's pretty important to really recognize. And this is where caregivers like myself could play a role in assisting with tech education, adoption, and sustainability. So those are my final words.
Amazing. Thank you all for an incredible panel, and thank you to all of our participants.